Welcome. Today we're going to be talking about etiquette for the medical student in the operating room. First of all, congratulations on making it to your first operating room experience during your general surgery or another clerkship. There's a number of things that you should know before you even get to the OR. First, I'd like to cover the attire that you should be wearing, information about your patient you should know, what you should do to scrub in and get ready for the case, what you should know and do during the procedure, and what to do to be helpful after the procedure. So, first of all, let's discuss the attire. You should be wearing clean scrubs, along with a hairnet and face mask. Some institutions might require shoe covers as well. An important landmark in the OR is a thick red line. Not all hospitals have this, but if your hospital does have it, you should be aware that you can't cross this line if you're not wearing the right clothing. This includes making sure that your white coat is hung up and you're not wearing it. So, part 2, knowing your patient. This step is critical, and each surgeon has a different set of expectations for the student during the procedure. It's extremely important that going into your first few surgeries with each surgeon, you know all the details that you can possibly know about your patient unless you've been warned ahead of time. A seemingly minute detail, such as some obscure diagnosis or lab value, can turn out to be very important either because it's directly related to patient care or because it's intellectually interesting. You should start by memorizing pertinent laboratory data. Next, you should be aware of the patient's HPI. You should know any active medical problems they have. The indications for the procedure are probably the most important thing to know. You should know any past medical history for this patient, and a social history can be important as well. Does this patient drink? Do they smoke? Do they take IV substances? You should know if the patient has a stable home to go back to where they can recover safely. Furthermore, you should know the medications that the patient's on. Some medications can directly affect surgery, such as anticoagulants. You'll be expected to know the anatomy of the procedure as well. You may not be expected to know every step of the surgery, but you should certainly know relevant landmarks and items of anatomic importance. Part 3. Scrubbing into the OR. First, you should get your gown and gloves from the scrub tech and put your name on the board. You should be respectful of everybody in the room as you get oriented. You should help however you're asked and volunteer for any jobs, like lifting the patient or helping the nurse put a Foley in, or pulling up radiographic images during the case. Remember to be pleasant, as everybody, including the secretaries, could have a say in your final evaluation. Each hospital has its own unique scrub policy, and you will probably be taught this before you enter the OR. In general, you start by scrubbing your hands with soap and water like normal. Then a more complicated process involving washing your hands with a brush and chlorhexidine or iodinated soap. Generally, you start at the fingertips with the brush and work your way down until you get 1 or 2 inches past the elbow. Don't try to dry your hands because this will happen in the OR. Keep your hands sterile as you enter the room, don't touch anything like the door, and keep your hands within a small box once you're gowned. This stretches from the waist to the shoulders. Anything outside of this box is not sterile and should not be touched. For your first few cases, it may take you a long time to get ready, so you might want to start scrubbing before everybody else. Part 4. The surgery. At this point, you should pretend like you're a soldier in the army. It's best not to speak unless spoken to, and once you have a better idea of what the surgeon expects, then you can be a little bit more like yourself. Don't touch anything that you're not asked to touch, especially sharp things or things that aren't sterile, which is one reason you should always be aware of what's sterile and what's not. This is called the sterile field. In general, you won't be expected to do more than retract or suction during the case. Many students enter a case thinking that they may be able to cut or sew during the procedure, but this is very unlikely. You may do a little bit of this near the end of the case and under close supervision, but do not expect to do any. Furthermore, during the case, the surgeon may pimp you. Common questions include what nerve is this, or what artery am I going to clip during this procedure, or physiologic questions. In general, the more you get right, the more the surgeon likes you. The questions should probably get harder, and this is a good sign. Once you start getting stumped, you know you're doing a good job. Part 5. After the surgery. So, congratulations on making it to the end of your first case. By now, you should help the resident and the rest of the team prepare the patient for postoperative care. This involves disposing of drapes, moving the patient from the OR table to their bed, which you've gotten from the hallway, and helping transport the patient to the postoperative care unit. Furthermore, you should use any time you have after you've asked what you can do to help to prep for the next case. So let's discuss some take-home points. So, first, be sure to be dressed appropriately and know your hospital's policies for scrubbing in. I can't emphasize this enough. Know your patient. Know the indications for the procedure and any relevant anatomy or pathophysiology. You should assume that you are the lowest rung in the ladder in the OR and be thankful for any attention you get. You should always be helpful and always be respectful. You should take any criticism you get with a smile and don't take anything personally. Thank you very much for watching this video.